Hello everyone, welcome back to the 500 MCQ series of Drug Inspector exam. So in today's video, we'll be discussing the question number from 66 to 70. So without any further delay, let's move on to the first question of the day. Which of the following statement is false? A choice, pegloticase is longer acting than rasparicase. B choice, sulfenpyrazone is related to phenylbutazone. C choice, aspirin is contraindicated in acute gout. D choice, colchicine is the drug of choice in acute gout. And E choice, all of the above. So which of these five statement is false or wrong? That is the question. Okay. So let's analyze each of the choice. So the first choice is pegloticase. Pegloticase is longer acting than rasparicase. So we need to know what is pegloticase and rasparicase. So rasparicase and pegloticase. These drugs comes where? These drugs comes in the treatment of chronic gout. They are used in the treatment of chronic gout. Now in chronic gout, you know, the uric acid level in the serum will be very much elevated. So the mechanism or the treatment strategy is to decrease the uric acid. The objective in the treatment of chronic gout will be to decrease uric acid. Now we can decrease uric acid mainly by decreasing the synthesis of uric acid. We can decrease the synthesis of uric acid, and that is how we can inhibit an enzyme called as xanthine oxidase. If xanthine oxidase is inhibited, uric acid synthesis can be inhibited. The second method is that we can increase the excretion of uric acid. Increase the excretion of uric acid. So if you can increase the excretion of uric acid, still you can bring down the uric acid in the serum. And those drugs which increase the excretion of uric acid is called as uric drugs. Drugs. Now, what is the third strategy? The third strategy to decrease the uric acid in the serum is that increase the metabolism of uric acid. Increase the metabolism of uric acid. So these are the three strategies normally employed in the treatment of chronic gout. Okay. Now, which are the drugs coming under the xanthine oxidase inhibitor? Which drugs comes under the xanthine oxidase? Yes, allopurinol. Allopurinol is a xanthine oxidase inhibitor. Febuxostat. Febuxostat is a xanthine oxidase inhibitor. And which are the drugs coming under the uricosuric drugs? Yes, probenecid is a uricosuric drug. Probenecid increase the excretion of uric acid. Sulfenpyrazone. Sulfenpyrazone can increase the excretion of uric acid. Benzbromarone. Benzbromarone can also increase the excretion of uric acid. The new drug called as lesinurad. Lesinurad can also increase the excretion of uric acid. So these four drugs are basically the uricosuric drugs, whereas allopurinol and febuxostat are xanthine oxidase inhibitor. Now, coming to the third strategy, we can increase the metabolism of uric acid. If you can increase the metabolism of uric acid, still we can bring down the uric acid level. Correct? So normally in the uric acid is a poorly water soluble substance. Okay. So in birds there is an enzyme called as uricase enzyme. So this enzyme is present in birds. Okay. So in birds, what happens is that the uric acid will be further metabolized to a water-soluble product called as allantoin. Allantoin, and it is a water-soluble product. So, so there will not be any accumulation of uric acid in birds because due to the presence of this enzyme. However, this enzyme is not present in humans. If this enzyme was present in the humans, where the uric acid could have been metabolized further and there would not have been any hyperuricemia, correct? So so what the researchers have done is that we have synthesized this uric acid, or you sorry we have synthesized this uricase enzyme synthetically by the recombinant DNA technology, and we have utilized the recombinant DNA technology to synthesize uricase enzyme, synthetic uricase enzyme. Okay, so that synthetic uricase enzyme is called as raspberrycase. Okay, so raspberrycase is nothing but a synthetic uricase enzyme developed by recombinant technology. Pegloticase is the derivative of raspberrycase, where the pegylation is done. Okay, what is pegylation? Polyethylene glycol. Polyethylene glycol is added to this uricase enzyme, raspberrycase, and it is pegylated so that if you add the peg, you can increase the duration of action of that drug. Okay, so basically, raspberrycase and pegloticase are those drugs which can increase the metabolism of uric acid. So the drugs coming under the third category, that is the drugs which increase the metabolism of uric acid, is raspberrycase and pegloticase. They are nothing but they are synthetic uricase enzyme. They are synthetic uricase enzyme developed by recombinant DNA technology. Now, pegloticase, the advantage is that it contains polyethylene glycol, PEG, abbreviated as PEG. You know that polyethylene glycol will not be readily eliminated from the circulation, so that the duration of action of a drug could be increased by the pegylation. Okay, so compared to raspberrycase, pegloticase have longer duration of action. The duration of action will be longer compared to raspberry case. Okay, so that is the advantage of peglotic case compared to raspberry case. Okay, so both are having the same mechanism. They are synthetic uric acid only, but peglotic case, since it contains the polyethylene glycol, it have longer duration of action. So now let us look into the first choice. The A statement was peglotic case is longer acting than raspberry case. So is it correct or wrong? Yes, it is correct only. Okay, now let us look into the second choice. Sulfenpyrazone is related to phenylbutazone. Now, if you look at this, the various strategy to treat chronic gout, I have told you the second strategy is to increase the excretion of uric acid, right? That is, they are called as uricosuric drug, and the drugs are probenecid, sulfenpyrazone, benzbromarone, and lesinurad. Now, this sulfenpyrazone, which is a uricosuric drug, is a phenylbutazone derivative. Phenylbutazone derivative, which we have discussed in the NSAID, non-steroidal anti-inflammatory drug category. Phenylbutazone is an NSAID drug, and sulfenpyrazone is basically related to the structure of sulfenpyrazone is related to phenylbutazone. Now look at the B choice. Sulfenpyrazone is related to phenylbutazone. The answer is correct. Now let us look into the C choice. Aspirin is contraindicated in acute gout. Yes, aspirin is contraindicated in acute gout. Is it correct? Yes, it is correct, because aspirin increases the uric acid level. Aspirin can increase the serum uric acid level normally at a low dose, or that the therapeutic dose, it can increase the serum uric acid level. So in acute gout, you know that the uric acid level will be more and it will be accumulating in the joints. So if aspirin is given, that acute gout will be aggravated or increased or accelerated. So therefore aspirin should not be given in acute gout. It is contraindicated. That means it is correct. Okay, so C choice, aspirin is contraindicated in acute gout, is correct only. The statement is correct. Now coming to D choice, colchicine is the drug of choice in acute gout. So already we have discussed the treatment strategies in chronic gout, right? We have already discussed the treatment strategies in chronic gout to decrease the uric acid level. Now in the case of acute gout, the main problem is the pain and inflammation, correct? How this happens? The uric acid will get accumulated in the joints and the pain and inflammation would be there. So in the case of acute gout, the main treatment objective is to decrease the pain, and it is the main objective is to decrease the inflammation. These are the two objectives in acute gout. So normally in the case of acute gout, the first drug or the immediate drug which will be given to reduce the pain and inflammation will be the non-steroidal anti-inflammatory drugs, just like diclofenac, naproxen, aceclofenac, etc. Okay, so NSAIDs will be the first line drugs which is given in the case of acute gout, so that NSAIDs can decrease the pain and inflammation. If the pain is and inflammation is not controlled, you can give corticosteroids. So the second line treatment are corticosteroid. If the pain and inflammation is not rectified by NSAIDs, then you need to start with the corticosteroid. Now, if still the pain and inflammation is not coming down, the third line of drug is called as colchicine. Colchicine. Colchicine is a very good drug for treating acute gout, but due to severe toxicity, they are not the first line drugs. The first line drug is always NSAIDs, followed by corticosteroid. And if the pain and inflammation is not controlled by NSAIDs and corticosteroid, then the best option would be colchicine. So NSAIDs are the first line drugs in the treatment of acute gout. So here in the D statement, it is given colchicine is the drug of choice. No, the answer is NSAIDs are the first line drugs. Colchicine is preferred after the, if NSAIDs and corticosteroids are not working, then only we will prefer colchicine. So this D choice is a wrong statement. Okay, so the question here is that which of the following statement is false? So definitely the answer, the correct answer for this question is D choice. Colchicine is not the drug of choice. Here it is given wrong. Okay, hope you understood the first question. Let's move on to the second question of the day. Which of the following drug induce hyperuricemia? A choice furosemide, B choice pyrazinamide, C choice ethambutol, D choice thiazide diuretics, and E choice all of the above. So uric acid, the certain drugs, some of the drugs can increase uric acid level. That means some of the drugs can cause hyperuricemia. Okay. So if uric acid level is increased by drugs or certain disease, we will call such hyperuricemia as secondary hyperuricemia. So if the uric acid level is elevated or increased due to the presence of drugs or any kind of disease, we will call such hyperuricemia as secondary hyperuricemia. Now, which are the drugs which can increase the uric acid level? Number one, you need to remember diuretics. Diuretics, some of the diuretics can increase the uric acid level, and mainly the loop diuretics. Loop diuretics can increase the uric acid level, and the main example in loop diuretic is furosemide, correct? So loop diuretics can increase the uric acid level, that is hyperuricemia, and thiazide diuretics. Thiazide diuretics can also increase the uric acid level. That means diuretics can cause secondary hyperuricemia. Apart from diuretics, anti-TB drug, anti-tuberculosis drugs can increase the uric acid level, and the main anti-TB drug which causes hyperuricemia is pyrazinamide. Pyrazinamide, which is a first-line anti-TB drug. Another example is ethambutol. Ethambutol also can cause hyperuricemia. Now, third one, which we have already discussed in the previous question, at the therapeutic dose can aspirin at the therapeutic dose can, or the low dose or therapeutic dose can increase uric acid level. That is why aspirin is contraindicated in acute gout. So aspirin can also cause hyperuricemia. Now the fourth one, levodopa, the anti-Parkinson drug levodopa also has reported to increase the uric acid level. Another one, immunosuppressant drugs. Immunosuppressant drugs like cyclosporin. Cyclosporin is an immunosuppressant drug which can cause hyperuricemia. Tacrolimus. can cause hyperuricemia drug. Apart from that, all this anti-cancer drug, chemotherapy drug, cytotoxic drug, that means therapeutic agents, chemotherapy drugs. So this anti-cancer drug can also increase uric acid level. That is why whenever we give an anti-cancer drug, we will give allopurinol to decrease the uric acid level, because in whenever you give an anti-cancer drug, the uric acid level can be elevated. Okay. Also, you need to remember certain AC inhibitors, angiotensin converting enzyme inhibitor like lisinopril and ramipril can increase the uric acid level. So these are some of the important drugs which can increase the uric acid level. That means it can cause secondary hyperuricemia. The examples are diuretic, anti-TB drug, aspirin, levodopa, immunosuppressant like cyclosporin tacrolimus, anti-cancer drug, and AC inhibitors like lisinopril and ramipril. Now coming back to the question, which of the following drug induce hyperuricemia? Furosemide is a loop diuretic which can increase uric acid level. Pyrazinamide, the anti-TB drug, can increase uric acid level. Ethambutol, anti-TB drug, which can increase the uric acid level. Thiazide diuretics can also increase the uric acid level. So the correct answer for this question will be E choice, all of the above. Let's move on to the third question of the day. The anticoagulants most commonly used to store blood in the blood bank is A choice, EDTA, B choice, sodium citrate, C choice, sodium oxalate, D choice, heparin, and E choice, acid citrate dextrose. So the question is the anticoagulant most commonly used in the blood bank. Okay, that means you need a blood thinner, right? Whenever you store blood, you need a blood thinner or an anticoagulant for the storage during the storage time. Okay, so let's understand what is an anticoagulant. So anticoagulant, you know that it prevent the coagulation of blood. They are blood thinners. So they can be of two types. One is the in vitro, that means for this storage condition or the in vitro condition, you can add certain anticoagulants. Also, some of the anticoagulants can work in the real condition, that is in the in vivo condition. In vivo condition, you know that and warfarin heparin and warfarin are the anticoagulants used in the in vivo condition, whereas in the in vitro condition, again heparin can be used both in the in vitro and in vivo. Okay. Apart from heparin, the anticoagulant which is used in vitro, the examples are sodium citrate. Sodium citrate. Next example is sodium oxalate. Sodium oxalate is an in vitro anticoagulant. Also, the citric acid. Citric acid is an in vitro anticoagulant. Then comes EDTA, ethylene diamine tetraacetic acid. EDTA is an anticoagulant used in the in vitro condition. Apart from that, acid citrate dextrose, ACD, acid citrate dextrose. Acid citrate dextrose is also called as citrate. Acid citrate, the ACD is also called as citrate phosphate dextrose. Citrate phosphate dextrose is the other name of ACD or acid citrate dextrose. Mainly it contains citric acid, then sodium citrate, sodium citrate, and dextrose in water. These are the three components in ACD. Okay, citric acid, sodium citrate, and dextrose in water. Okay, so these are actually the in vitro anticoagulant. Now, in the for storing the blood in blood banks, the most preferred anticoagulant or in vitro anticoagulant is ACD, acid citrate dextrose. They basically decrease the calcium level so that the blood could be stored for a long time. So they are anticoagulants mainly used in the blood bank. What is the name? ACD or acid citrate dextrose. So although EDTA, sodium citrate, sodium oxalate, heparin, they are in vitro anticoagulant, the most preferred anticoagulant in the blood bank is acid citrate dextrose. So the correct answer is E choice. Let's move on to the next question. Vitamin P is A choice biotin, B choice coenzyme Q, C choice hesperidin, D choice choline, E choice niacin. Okay. So this is a direct question. Vitamin P is mainly the flavonoids. Vitamin P is given for the flavonoid hesperidin. So hesperidin is also called as vitamin P. Okay, hesperidin or this flavonoid is also called as vitamin P. Okay, so the answer is C choice, hesperidin. Vitamin P is hesperidin, whereas biotin is called as vitamin H. Vitamin H is biotin. Coenzyme Q is also called as vitamin Q. Vitamin Q or coenzyme Q. Whereas choline is vitamin J. Vitamin J is called as choline. Coming to niacin or vitamin B3 is also called as vitamin PP. Vitamin PP or vitamin B3. Okay. So these are the different names of each of these compounds. And the answer for this question, vitamin P, is hesperidin, which is a flavonoid. Let's move on to the last question of the day. Which of the following is an acidic drug? A choice, atropine. B choice, amphetamine. C choice, methotrexate. D choice, morphine. And E choice, none of the above. So it's again a simple question. So you know that atropine is a basic drug. Atropine is a basic drug. Amphetamine is also a basic drug. Morphine is also a basic drug. Whereas methotrexate is an acidic drug. Methotrexate is an acidic drug. Other than that, aspirin is an acidic drug, weakest acid drug. Then barbituric acid, barbiturates, they are also weakly acidic. So aspirin, barbituric acid, methotrexate, they are basically acidic drugs. So here the answer for the question will be C choice, methotrexate. So the correct answer will be C choice. Okay. So hope you understood today's discussion from 66 to 70. Meet you again with a new video. Thank you so much.